Today on Real Pilates, we're going to talk about your muscles. In particular, we're going to talk about the muscles of your eyes. Every time you blink, those are muscle contractions. Did you know that there is a connection between the eyes and the nose directly? There is a nasal lacrimal duct in each eye that connects the eyes to the nose and the nose to the eyes. So those tear ducts connect both ways. Have in mind that you're peeling an onion. The vapor of that onion comes in through the nose and it also affects the eyes and the nose begin to tear. You may not realize it, but anything that you spray or smell with the nose affects the eyes, like smoke. If you smell it, it'll get into the nose, it affects the eyes, and you're not sure where the smoke is making you cry from. Is it the eye, it's the nose? It's really both. So you need to pay attention to everything that goes in through the nose. Nasal sprays, things that you put on your body like perfume, deodorants, and such, always will affect the eye tissue. A lot of the nasal sprays contain corticosteroids that will affect the eyes over time, and you may not realize it, that you can be putting your eyes at risk. Perfumes and things that are available on the market, obviously there are some fabulous products, but there are a lot of products that are synthetically and chemically derived, and they're really not good for you. It's always best to try to use substances that are more natural and simplistic. Essential oils for perfuming you, like ylang ylang, frankincense, lavender, are really gentle on that whole nasal eye duct connection. Also, things that you brush your teeth with and mouthwashes that have a lot of chemicals in them adversely will affect the eye tissues of your body. So again, going back to things that are basic like real mint, real cinnamon, and things that are a little bit more gentle for the throat will also be kind to your eyes. This is Pilates Master Nikki, and I'll see you for another layer of Real Pilates. Today on Real Pilates, we're going to talk about your two extra brains. What? Did you know that your eyes are really an extension of the brain? They are considered the window to the brain. In fact, your eyes are formed from the frontal lobe of the brain before the third week of your life stage as you progress as a little baby seedling. There is a huge connection in the structural functions and psychological and physiological functions of the eye and the brain tissues, and their identical structure and continuity as far as embryonic levels and physical levels are concerned. Your eyes really are an extension of your brain. So they have discovered recently that a lot of disorders of the brain can be early detected through examination of the retina. So the retina in particular is directly connected to the central nervous system of the body. The cells of the retina have a lot of similarities to the cells of the brain, as we've discussed. So the biomarkers for degeneration of the brain are visibly picked up through scans that are done, retinal imaging, that now new technology has come out recently that you can ask your doctor about. So things like Alzheimer's, Parkinson's, brain issues that can be detected early by just a thorough examination and a screening of your eyes. Things even like diabetic retinopathy and, of course, the degeneration of the eye basic nerve. There are many things that we can do to protect our eyes, and of course, through nutrition is one of the most basic, easy ones to do. So the lutein and zeaxanthin, which usually are coupled together in foods, really help stimulate and protect the eyes. Things that contain the carotenoids help with the eye pigment, which helps stimulate the eye texture and health. and longevity. So things that you can eat are things that are dark leafy vegetables, the spinach, the kale, right? You hear this all the time. I know you're bored of me telling you that, but things that are orange in color, no, not cheese doodles. Things that are naturally orange in color, like oranges, red and orange peppers, paprika, the egg yolk, which egg yolks get such a bad rap. Eat your egg yolks, but don't eat a bajillion of them. Actually, kiwis, peas, and oranges are some of the things that contain that carotenoid, which helps you strengthen the pigment of the eye. Also, the DHA, the 3 omega fatty acids, 600 milligrams daily, is another thing to help you protect your eye, which helps you protect your brain. This is Pilates Master Nikki. I'll see you, your eyes and your brain, in class real soon. Today on Real Pilates, we're going to talk about the ear-stomach connection. In the middle part of the ear, you have tubes that are called the eustachian tubes. You may have heard of them. They are an opening that connects the nasal sinuses into the throat. Sometimes you can have swelling and issues in the eustachian tubes, and there are many causes. One common one is called barotrauma, and that can be caused by high altitudes. If you go up high in the mountains, if you take an airplane and go way up high, if you go way down low under the ocean in scuba diving or free diving, and that puts pressure on the ear. Other causes of the eustachian tube swelling can be things like allergies, colds, where you have a buildup of fluids and mucus that can accumulate in that inner ear. And that increased ear pressure can lead to things like dizziness, loss of balance, tinnitus, that ringing that you get in the ears that's annoying, vertigo, other ear issues, and you can even have eventual hearing loss if you don't tend to it immediately. The ears obviously need to be cleaned, and not by digging with a Q-tip, because you can damage your ear. Obviously that outer part you can dry with a Q-tip, but they have special cleaners. Some of them are oil-based that help soften the wax. Others are peroxide-based that help melt the wax. They have all special little ball cleaner things that you can gently clean your ear. And of course, you can always go and have them professionally cleaned by a doctor. And it's important to have your ears looked at inside by a specialist so that you can make sure that everything in there is copacetic. Coming up, we're going to talk about things that can really affect the ears, like your stomach and its digestion. Remember, if you get that clogged ear, chewing gum, yawning, and if you just gently pinch the nose and close the mouth and gently blow, it just kind of pops the ears. Always be gentle with that. This is Pilates Master Nikki. Love hearing you, and I'm glad you're hearing me, and I'll see you real soon for another layer of Real Pilates. Today on Real Pilates, we're going to discuss the ears and your stomach. The ears and the stomach are connected, as we discussed, through the esophagus and the eustachian tubes that connect that whole nasal throat part of your body. If you have a phenomenon known as acid reflux, which is acid of the stomach that instead of staying down there comes upward, it's also called GERD, G-E-R-D. That can lead to problems of the ear. 20% of Americans are estimated to suffer from some kind of acid reflux or GERD. Sometimes you have it and you don't even realize you have it. Other times you really know you have it. You get that upper chest pain, you get that heartburn pain, you may have that constant cough, that you may not realize that constant little cough is really acid that is coming up. You can have a sore throat. You can even have the gums in your mouth start to recede from constantly having that stomach acid, which is very strong. So why is that coming up? There is an esophageal sphincter muscle, a muscle. A sphincter is a round muscle like your eye. I was going to say another muscle that we're sitting on. You know what I'm talking about? When you go to the toilet, right? Those are sphincter muscles. When you have a weak lower esophageal sphincter, known as LES, L-E-S syndrome, right? It's that little ring. It doesn't close properly all the way, and that acid can back up. There are things we can do to strengthen that muscle. You knew you could count on me. If it's a muscle, we can tone it for sure. But there are some things that can cause it. So a hiatal hernia, which is the top part of the muscle of the stomach that bulges out, drinking too many carbonated drinks. If you eat a giant meal and you lay down right after, that can ease that sphincter from not closing. Smoking, because smoking tightens the diaphragm and it weakens that muscle. Stressing that diaphragm, you're going to see, is not a good thing. Obesity, but not for the reason that you think. Yes, the increased abdominal fat puts pressure on that sphincter, but when you have additional body fat, that changes your hormonal level, and that hormonal level can make all the muscles in the body softer. So that leads to the next one that can give you acid reflux, and that's pregnancy. Thank God pregnancy is usually temporary from the extra pressure and from the additional hormones that are raging in the body when you're having that baby in you, and that can lead to that softening, because as you're pregnant in the last trimester, your body releases a hormone to help you have that baby. And that softening of all the muscles is what also softens that little sphincter muscle. So there are tricks that we can learn. There are exercises that we can do, and we're going to do that in our next class. But there's a little quick home remedy that I'm going to tell you right now, and it's called mastic gum. Mastic gum is made from a tree or a shrub that's found in the Mediterranean and usually in Greece or Turkey. So I'm not endorsing any brand or any kind. I use this brand, and I have used this when I had it years ago, this mastic gum by Yarrow with a J. Take 2 before each meal. The resin does something to the cellular and the duodenal, I can't say that word, cells and tissues of the stomach. And it helps regulate that stomach acid. It's something that's inert. It's what chewing gum is made out of. Mastic gum is what all chewing gum used to be made of. You can order the teardrops, which when you get them and they're fresh, they're soft, and you can just chew them, chew them, chew them. You can swallow them if you like. If you don't like them, you can spit them out. They're super, super good when you chew them for the nose. I have them. I chew them all the time. They're excellent for the whole health of the digestive system. Next class, I'm going to give you exercises for that pesky LES little soft sphincter muscle. Yeah, this is Pilates Master Nikki, and I'll see you soon. Today on Real Pilates, I'm going to give you some exercises for your lower esophageal sphincter muscle. Oh, what is that? That's that little thing that closes so that the stomach acid doesn't come up and give you the acid reflux or the GERD. Your diaphragm, which is what separates the upper cavity of your body, that where the breath is, right? Your diaphragm is a muscle. It is a muscle of inspiration, not inspiration, but of breathing in. That when you breathe in, the diaphragm, which is like a parachute shaped, right? It goes down like an upside down parachute, and it helps you suck the breath in. When you breathe in, the diaphragm goes down and the ribs expand. When you exhale, the diaphragm comes up, and the rib muscles and abdominal muscles help you exhale. So exercise is important, believe it or not, to help with acid reflux. But there are real exercises you can do. It may not be the most funnest, so here is one. All right, So you're going to take a nice deep breath in through the nose, like the kind of breath you would take if you were to blow out a birthday candle. So I'm going to do it and show you. Taking a breath in. Then I lean over and hang forward, and I push out whatever air is left all the way out. Push it out, push it out, push it out, push it out, push it out. Pinch my nose, close my mouth, and then come up. So now you're up with no breath, right? So now, after you've exhaled all that air, you're going to go. It's just a sucking. I'm trying to breathe in and out, but I'm not. Do as many as you can without feeling like you're going to die, and then release. Wait a few minutes and then do that again. When the diaphragm is too tight from stress, that is what weakens that LES muscle and helps the stomach acid escape. Yes, there were medicines for that, but you can help or alternatively, try the natural road to helping cure that. So I'll do that again. I'm going to take a deep breath in through the nose like I'm blowing out my birthday candles. Then come forward, push all the air out. Let the weight of my body push the air out, push the air out. When there's no air, pinch the nose, shut the mouth, and it's not that bad. That really helps train the diaphragm. You can do that 2 to 4 times a day. Okay, so that's exercise number 1. Exercise number 2, take a cork of a bottle of wine or something that's soft. I'm going to use this pen, but do not use a pen. I'm going to use the back. Pretend it's a pencil and it's an eraser. Pretend. Okay. So there is the very tip of your sternum, which is called the xiphoid with an X. Ooh, the xiphoid process. That is technically where the ab muscles begin. So follow the ribs, follow the yellow brick road, follow gentle. It's tender here. You're going to come to the center. There's a little tiny bone that just hangs down. Don't worry if you can't find it. Just find the top there of that soft part. Okay. On either side, like a 1/2 to 1/4 inch, that is where the diaphragm is attached to. So if you take something soft and in a little point, that's why you take a cork and you kind of cut it in half, so it's, and you just gently find that spot and push inward. On a pain scale, it needs to be a pain scale, you know, if 10 is your max, you want to push down in there a 9, I'm sorry, like it should be uncomfortable. You'll know. If you have a tight diaphragm, you'll feel it immediately. If you have a good diaphragm, you won't have any pain, so don't poke yourself saying, oh, it's got to be a 9. Just press. Hold that for 2 whole minutes. So like I'm pressing mine firmly with my finger because I'm an animal, and it's uncomfortable, like it's not killing me, but it's starting to soften. After the first minute, it'll start to soften. Hold it for an additional minute. Release it and then do the other side. I know there's 2 sides of the outside of the xiphoid process. Do that. And I recommend you do that before each meal. You can quietly just do it at the table with your finger. Oh yes, darling, your conversation is marvelous, marvelous, right? And don't forget also the mastic gum that we talked about in the previous class. This is Pilates Master Nikki. May all your days be filled with sunshine. I'll see you soon for another layer of beautiful diaphragm and Real Pilates. Today on Real Pilates, we're going to talk about your breath and how your breath can help you eliminate toxins. So the obvious is when you breathe in, you're getting oxygen, which oxygenates the body on the cellular level. Yes. But what you may not realize is that when you exhale, you are helping your body eliminate toxins. What kind of toxins? Not just the carbon dioxide, that is the waste product of cellular metabolism, right? So the cells eat the oxygen and that's the waste product. Through exhalation, you're also getting rid of lactic acid. Lactic acid is a byproduct of muscle contraction, plus other toxins like urea and creatine. So the thing about the breathing is the deeper the breath, the more toxins you get out and the more oxygen you get in. For you to breathe deeply, you need to use more diaphragmatic breathing as opposed to just shallow upper lobe breathing. So when you're breathing, you really don't want your shoulders going up and down unless you're doing a full out exertion and you're recovering, then breathe in through your hair if you need to. But just your general breathing wants to be lower. For you to breathe deeper, you need to have a couple of things. You need to have more rib space. So stick your finger between each rib. How much space do you have? You should have minimum one finger that fits between, there's ribs up here, any rib. When you take a deep breath in, you should have minimum 2 fingers space. I have 3. What can I tell you? I'm a hag. I've been doing Pilates for 50 years and my ribs are like snappy. Yours will get snappy. You don't need 50 years. So that rib space is the other thing. And then, of course, pelvic floor. Pelvic floor, which is the bottom of the abs, is what the diaphragm, the parachute thing that helps bring the air in, because the lungs are just soft. The lungs are a slave to the diaphragm, which is a breathing muscle, and to the ribs that expand or don't to allow the lungs to fill. Your lungs can grow bigger and stronger if you fill them more. Yes, you have to train your breathing. It's important because breathing is super important. Like try being sexy and not breathing. Yeah, if you're into that, we'll talk later. It's a nasty thing. But moving ahead, the breath is critical for removing toxins of the body. When your lymphatic system is cleaner because now all of these toxins are being pushed out, you have a better immune system. So if you increase your walking speed, let's say now you've decided, because I told you that when you park your car to go to the market or to work, you're going to park a little further. So you have to walk further. As you walk, do 10 seconds at a faster speed and just go 10, 9, 8, counting like that, just for 10 seconds, just to increase your breath rate and increase your breath volume. That is enough. You don't have to go berserk with it. Trying to increase your breath volume every day in the long run will help you clean your body out, look better, and feel better, and regenerate and stay young. This is Pilates Master Nikki, 71 this year. Young, young, young. I'll see you soon for another layer of real Pilates. Do you remember being told when you were younger, don't stare, it's not polite? Right, it's not polite to stare, but it's not good for your eyes to stare. Like, look at those socks that he's wearing. I can't believe they're over his knee with sneakers. Don't stare. When you stare, your eye muscles become static. Staring at a screen, watching the movie, watching the computer, watching the phone. Staring weakens the eye muscles. Your eyes need movement so that they can get nutrition in and toxin out. When your eye muscles weaken, you start to lose the ability to lubricate the eyes correctly. Eye lubrication is critical to keep the health of the eyes. All right, so here's something that's an easy little trick for you to do. If you have a candle at a safe distance, like 8 feet, or a low light, it shouldn't be something that's blaring at you. Stare at it straight ahead, and then keeping your gaze on the candle or little light bulb, turn your head slowly as far as you can and still see it. Slow and steady. Do about 10 right and left, and then drop the head all the way down so that you can almost not see it, and then bring the head up slow, keeping your focus and gaze on the eye. Yes, it is also good to put something in front of you. So bring your thumb in. When you see your thumb start to double, back it up a little bit just before the doubling. So there's my thumb. It's just one, but if any closer, it's a double. Look at your thumb, look past the thumb. Look at your thumb and look past. Preferably do that out a window at a long distance. The looking near, looking far, looking near, and force your eyes to focus helps strengthen deep eye muscles. It's really good if you can remove your glasses and contact lenses and go out. Of course, stay safe and don't do this driving, and go out without glasses or without contact lenses. Yeah, you should bring somebody with you, right? So that your eyes for an hour at least a day can get used to having to focus without the help of the lens or the glass. And don't squint. That helps strengthen your eye muscles. It will. Constantly wearing glasses, weakens the eye muscles. Hard, rigid contact lenses help the retina and actually help the eyes. Soft lenses are not as good at all for the eyes, and they also cover the eye so that your eyes breathe less. So while the eye gets oxygen from the blood system, the cornea does not. The cornea is what is called avascular. It has no veins that run through it. It's the sheathing that covers the eye, and that part of the eye absorbs oxygen when your eyes are open. Yes. So try to train your eyes by doing the near-far thing, by making your head turn, and of course the classic figure eights with your eyes nice and slow, tracing an 8, and then reversing. This is Pilates Master Nikki, and I'll see you in class. Today on Real Pilates, we're going to talk about your eyes. Did you know that your eyes are excitable? That your eyes can change your heart rate and breath rate? So if you're looking at something that's exciting, like somebody that's base jumping into a green forest, that excites your eyes and captures your attention and can lift your heart rate and your breath rate. A scary scene from a movie, as you're watching it, sends signals to the brain that obviously can lift up your heart rate. But when your eyes look out and see something that is considered to be an attention grabber or something that is a threat, your vision field narrows and your focus on that one thing becomes hyper-focused, and the things around it slightly become blurry. This is a primitive, ancient mechanism that stress controls your field of vision. So if you're intent on seeing that one little thing, like you're waiting for that one person to come out at the airport and you're scanning, and you see them and your vision attaches to them. This focal vision activates your sympathetic nervous system. Your eyes are two parts of your brain that are outward so that you can have a quicker brain reaction time, because the eye is considered part of the brain. It has similar cellular structures. We've talked about that in the other class. If you look at a long distance far away and you look, your eyes naturally are going to scan the horizon from right to left. This is a natural shift that happens as your response to survival. It's that primitive thing. You don't even realize that you're doing it. And as you look out and you start to see after the first sweep that it's beautiful, there's a nice landscape or cityscape or oceanscape, and you see that you're safe, that starts to slow the rate of frames that are projected into the brain down. It slows the rate down, the visual rate, and that relaxes you and relaxes your breath. If you are in a closed room where your field of vision is narrow and you can just see 5 feet, 4 feet, 3 feet, that shortness of vision keeps your brain at a more excited state and accelerates the frames or bits per minute that are projected from your eyes to your brain. So it's easy to get stressed out in a small room. You ever notice you're in your work and you just, I need to go out and stretch my legs. You go out into a bigger space, a hallway, you step outside, and all of a sudden you feel better. That's because that is that ancient system that is designed to protect you in your eyes. It's good if you can to look away from your screen, even for just 15 seconds for each 20 minutes. It's that 20-20 rule. Looking at your screen after 20 minutes, look away for 20 seconds, and then come back looking at your screen. Wearing blue lenses also really does protect that whole excitable thing in your eye-brain connection. Remember, stress is good. It can protect you in a dangerous situation. Too much stress is not good for you. It degenerates the body and makes you wrinkly. This is Pilates Master Nikki. Exercise is good to help alleviate stress. And I'll see you real soon in class.